Hello, everyone. I would like to discuss menopause. The reason is that in the African setup, we have very few women coming to our clinics complaining of problems related to the menopause. It's a cultural thing, probably, and I think many people feel that it's a natural process, so why should we complain? But I think that there are a lot of women suffering out there. And if the knowledge was there, I think we would have more women coming to the facilities trying to get help because of problems associated with menopause. So I'll start with definitions. What is menopause? Menopause medically is that last period that a woman has. That's the medical definition of menopause. It is the last menstrual period that a woman has. And we can only say that a woman has had her last menstrual period 12 months after that last menstrual period. So it's a diagnosis that is made in retrospect. So that is what the menopause is. For many women, as I've already said, it's a natural process, but for so many other women, it comes after having radiotherapy, usually in our setup for cervical cancer, and for some from chemotherapy, again due to cancer-related conditions, and also a lot of women from surgery. So they have a hysterectomy and their ovaries are removed, and then their last normal menstrual period start. Of course, things like smoking make the menopause come earlier for women. Having a hysterectomy makes the menopause come up to 4 years earlier than usual. So that's about menopause. There's also what is called perimenopause. Perimenopause is that period from the time the estrogen in the woman's body starts going down. This happens about 4 to 6 years before the actual last normal menstrual period, before the menopause. So in this period, what is happening really is that the a follicle stimulating hormone, which is the hormone produced by the anterior pituitary, is starting to increase slowly and increases drastically after that last normal menstrual period. That is what is happening. The reason the follicle stimulating hormone is increasing in that period is because we know that the oocytes in the ovary have been there since the 60th week gestation age of this woman. So as the woman reaches puberty, more and more eggs start being recruited for ovulation, and we know that only one egg actually gets ovulated eventually. So a lot of good quality eggs have already gone out of the ovary by the time a woman reaches her last normal menstrual period. So it means that the eggs that are remaining are eggs that have not been able to respond to follicle stimulating hormone effectively, and that's why they are still there. So the amount of stimulation that these eggs need is much more. So the brain instructs the pituitary gland to produce more follicle stimulating hormone to try and make these eggs respond. These eggs that have been there for a long time, they are responding erratically to follicle stimulating hormone. So they need more of it to respond. So that's why it's going up and up and up and up. From around 35 years old, it continues to increase until that last normal menstrual period, when it increases drastically and then stabilizes after that. Estrogen is another story in this perimenopause, or what is also called the menopausal transition. So estrogen in this period, because of the erratic response of the oocytes to follicle stimulating hormone, estrogen is actually kind of going like that. So it's going up, down, up, down, up, down. So the response to follicle stimulating hormone of these oocytes is very erratic, and then estrogen is just zigzagging like that. So that is why these symptoms that women have in the perimenopause and after the menopause are very distressing. It's one of the reasons that maybe the women are having hot flashes, all those so-called vasomotor symptoms, because of this erratic up and down estrogen fluctuations. So that's about estrogen in the menopausal transition, or you can call it the perimenopause. Because the other issue that happens in the perimenopause, because of these fluctuations of estrogen, is that a woman can actually even ovulate twice during the same menstrual cycle, and sometimes can even ovulate during their periods. So that's why sometimes a woman thinks that they can't become pregnant once they're having these symptoms or vasomotor symptoms of the perimenopause time. But it happens that a woman would have this ovulations in that period, and that is why contraception is very important during the perimenopause and even after the menopause sometimes. So the advice as regards contraception, because of this issue that we are talking about, that women actually are ovulating, some studies have shown even 3 months before the last normal menstrual period, they're actually ovulating. So it's advised that women who have their menopause after 50 years old need to continue their contraception up to 1 year after the last normal menstrual period. The women who have their menopause before 50 years old need to continue with contraception for 2 years after their last normal menstrual period. So that is about the menopausal transition. Then we discussed the last terminology, which is the post-menopause. So post-menopause is a period from 12 months after the last normal menstrual period. So when 12 months elapses after the last normal menstrual period, you are menopausal. That woman is menopausal until she's postmenopausal until she dies. So those are the terminologies that we have that are associated with the menopause. So because of that, we don't normally say this woman is menopausal, because what does that mean? Because menopausal means that when you say menopause, you mean the last normal menstrual period. A woman can't say, for how long will I be menopausal? Because the menopause is that last normal menstrual period. So a woman is either perimenopause, meaning they're in the menopausal transition, or they are post-menopause. Those are the two terminologies. And then we say you are you have achieved your menopause has happened when it's 12 months and you've not had a period after that. So those are menopause basics that we need to know. And next time we'll talk about the technicalities, the treatment, hormone replacement therapy for menopause, and so on and so forth. But before that, we needed to know these basics. Thank you so much for listening, and we'll see you in the next one.